Hello, Ryan. My name is Dave Jacks. I'm going to be performing a head to toe physical assessment on you. The first thing I would do for this patient is provide privacy and wash my hands. And immediately I'm assessing I'm assessing how she's dressed. And a general observation, I see she's dressed appropriately for the weather. She's well nourished. She's a 31-year-old female in no acute distress. Ryan, can you tell me where you are today?
I'm at my house in Grand Rapids.
And what's the date?
August 3rd.
Where are you?
My house.
Oh, excuse me. Why are you here? What's going on?
I'm here for a physical assessment.
Okay. She is oriented ×4. Her speech is clear and coherent.
You might want to angle it, be louder. I'm just worried it's not going to pick up your voice.
I would test her muscle strength. So could you push your forehead into my hand? Thank you. Now push your head back. Push your face to the side towards my hand. Thank you. Push your face towards the side. Thank you. You can give it a little more oomph. And now shrug your shoulders up. Good. Thank you. Now I'm going to have you squeeze my fingers hard. Thank you. Push me away from you. Pull me towards you. Okay. And I'm going to have you raise your arms against force. So raise your arms up. Okay. Push your arms down. Okay. Then I'm going to have you kick your legs out. Good. And I'm going to have you pull your legs back. Thank you. And now push down like you're pushing down on a gas pedal. Good. And now pull up. Okay. The patient's muscle strength is a 4 out of 5 on a 1 to 5 scale. It's symmetrical and strong bilaterally in both upper and lower extremities. I'm going to check for sensation. So for this exam, I'll have you close your eyes. I'm going to touch you with something sharp and with something soft, and I'll check her dermatomes in 2 places on each extremity. Okay. So tell me sharp or soft?
Sharp. Soft. Sharp. Soft. Sharp. Soft. Soft. Sharp. Soft. Sharp.
And tell me which side of the body I'm doing it on and which area.
Soft right thigh. Sharp left thigh. Soft left shin. Sharp right shin. Soft right shin. Soft left shin.
The patient's sensation is symmetrical and intact bilaterally in both upper and lower extremities. Next, I will test her reflexes. I'd like to test your triceps, the C7 reflex. So I'm going to support your arm. I want you to try to have it relax. I'm going to find her. Let's see if I can. I'm going to find her elbow and go a couple centimeters above that. Okay, I'll test the other side. Okay, I'm going to test your biceps. So I'm going to support your arm. I'm going, if you can see on camera, I'm going to hit my thumb. I'm going to test on this side. Oh, sorry. I'll test your brachioradialis, your C6. Oh, sorry. I'll test the C6 on this side. I'll test your knee, the L4. dangle your legs in, and I'll hit right below the patella. And I'll test the top of the foot, right where the top of the shoe would be. Did I give this one, okay. Oh, and your Babinski. So I would start at the bottom of the heel and go out in a C motion towards the top of your toes. Sorry, that's kind of tough. Okay. So I see all of the reflexes, the deep tendon reflexes, and the Babinski are intact. Next, I'm going to test her station and gait. So Ryan, could you stand up for me, please? Okay, so stand up straight. Now I'd like you to take 5 normal steps forward. Thank you. Now walk back on your toes. Thank you. Now walk back on your heels. Okay, and now walk like you're taking a field sobriety test in a straight line. Thank you. Good, thank you. I see that the patient's station is normal and her gait is a normal tandem gait. Okay, I'm going to check now the patient's head. I'm going to feel for any lesions on the scalp. I don't see any. Head appears normal cephalon. I'm going to assess patient's pupils. So first I'd like you to open your eyes. I'm going to shine a light into your eye. Pupils, left pupil is a 4 with brisk reaction. Right pupil is a 4 with brisk reaction. Pupils react in tandem. And I'm going to have you follow this light for it. Okay, thank you. There's down and inward eye movement accordingly. So pupils are perla, equal, round, reactive to light, and accommodate. I'm going to look at you, inspect your nose. I see no nasal flaring. I'm going to inspect your mouth. Can you open your mouth so I can see your mucous membranes? Oh, thank you. Mucous membranes are pink, moist, and intact. I will inspect her neck next. Will inspect both sides. I see no jugular vein distension, and I would auscultate. Oh, and I see no shoulder shrugging or accessory muscle used for breathing. I also don't notice any pursed lip breathing. Next, I would auscultate her neck with the bell end of my stethoscope. Excuse me, I would palpate her carotid arteries one at a time. I feel no thrills. I would auscultate with the bell end, and while I auscultate each side, I would ask the patient to hold their breath so I don't get any respiratory interference. Could you please hold your breath? I hear no bruits. I hear no bruits. Next, I'll inspect your chest and lungs. First, I'll do a visual examination. I see the contour and shape of the chest wall are evaluated, and I see no accessory muscle use. I see no substernal retractions. I see no pectus carinatum or pectus excavatum. I see no evidence of barrel chest, and no patient tripoding. I will palpate the chest 4 spots on the front and 6 spots on the posterior chest wall. Could you just take some normal breaths for me, please? And then, are you able to angle a little bit towards the camera?
I'll like turn this.
That way, towards your left, please.
That's like way perfect.
Thank you. Okay, thank you. I feel no abnormal vibrations with respirations. You can sit back. I'll auscultate lung fields, 6 positions on the anterior wall, 8 on the posterior, and 3 under her axilla, with the diaphragm portion of my stethoscope. While I'm listening, would you breathe in and out through your mouth, please? And then are you able to scooch forward in your chair? And I'll listen to 8 positions on the back. You know what? I'm sorry. Could you face this direction so the camera can see where I'm placing my stethoscope? Okay, thank you. I hear no evidence of crackles, rhonchi, or wheezes. Lungs are clear, anterior and posterior. Next I would do the cardiovascular. First I would inspect, and I see no heaves observed or noted. I'll palpate the apical pulse, which should be left side mid-clavicular line, 5th intercostal space. And I'll assess for rate and rhythm. if it's a woman or someone who's obese or with a lot of dense breast tissue, I'd lay them in the left lateral position. And I would feel each valvular area, abdomen, starting second intercostal space. Move to the other side of the sternum. Third intercostal space. Fourth intercostal space. Fifth intercostal space. And I palpate no thrills over the cardiac valvular areas. I'll auscultate cardiac sounds over the same areas with the bell end of my diaphragm. Patient's heart rate is normal rhythm. I hear no gallops or rubs or murmurs or S3 and S4. I do hear S1 and S2. I would assess for capillary refill. I'll have the patient hold her hands above her heart, the level of her heart. Capillary refill is brisk and returns within 2 seconds. Check on the toes. Capillary refill is brisk in all 4 extremities. Next, I'll assess for pulses. I've already done the carotid pulses bilaterally. I'll do the brachial pulses. 2 to 3 centimeters above her elbow, the medial side. Radial pulse. I won't assess the femoral pulse for the purposes of this video, but I would on my patients. I'll check popliteal pulses. Check posterior tibial pulses. I'll check dorsalis pedis pulses. Okay. All pulses are 2+ and equal bilaterally. I will assess your abdomen next. And for this, may I have you lay on the couch, please? Excuse me, I'll test for the warmth of her extremities first. So I'll lay the back of my hands on, although I've been touching all of her extremities, I'll lay the back of my hand on all 4. And all 4 extremities are warm to the touch. I'll assess for edema. So I'll try to indent over bony prominences, and I don't see any pitting edema. Okay, I'll first inspect the abdomen. Abdomen is rounded contour. I see no abnormalities. I see no extensive bowel movement. Next, I would auscultate the abdomen. If the patient were in any pain in any of her quadrants, I would avoid those areas. Abdomen also has no visible scars. And I would listen to her abdomen with the the diaphragm end of my stethoscope. Do 4 quadrants. On a hospital patient, I would listen for up to 3 minutes on each. Bowel sounds are normal active. I will listen for her arteries, the aortic and renal and iliac arteries next. So the aortic artery is about 3 centimeters superior to her umbilicus. Renal arteries are bilaterally lateral to that. Iliac arteries are approximately 4 centimeters inferior to that. And for the purposes of this, I would not listen, for this exam, I won't listen to the femoral arteries. But on her other arteries, I did not hear any abnormal blood flow. Next, I'll percuss the abdomen. I should hear a nice tympanic sound over 3 quadrants. And the liver is more dense. I forget what's next. Oh, and I would